PISD student and families. As you get ready to return to school in person, the school nurses of PISD have some videos for you to watch and learn about some of the changes you will see at school this year. These are to help keep us all healthy and safe. Enjoy! When you wake up in the mornings, ask an adult in your home to take your temperature. There are many types of thermometers that you can use. Just make sure that you're taking your temperature using a thermometer. Remember also to take your temperature before you eat or drink anything. If you feel sick or have a temperature of 100 degrees or higher, please stay home from school. The second part of your morning screening at home will be to answer a few questions. You want to make sure that you have not been in contact with anyone that has a confirmed case of COVID-19 in the past 14 days. You also want to make sure that you read through the list of these symptoms and make sure that you aren't feeling sick or exhibiting any of the symptoms on this list. The final question is to make sure that you haven't traveled internationally in the past 14 days. If you answer yes to any of these questions, you must stay home. Please be aware if you are exhibiting any of these symptoms that you see listed here, you must stay home from school. If there's ever any doubt, it's better just to go ahead and stay home and rest. Before leaving your home to come to school, make sure you are properly wearing your face mask over both your nose and your mouth. You must wear your face mask while riding the bus. You need to be wearing your face mask before you get out of the car and before you enter the school building. If you do not have a face mask when you come to school, please tell an adult. You will notice signs posted at all entrances of your school to remind you to wear a mask and stay physically distanced at least 6 feet apart from other people. Remember, when you walk to your classroom, please stay physically distanced away from other people in the hallways. As you come into class, you will take your seat at your desk. Remember to always keep your face mask on. Your teacher will be taking your temperature in class. She will also be asking you a few questions, such as, how are you feeling today? Is anyone in your home sick? And have you traveled anywhere recently? If you are at school and not feeling well, tell your teacher. Your teacher will decide if you need to see the nurse. He or she may suggest that you try drinking water, resting at your desk, or using the restroom first. Then, if he or she decides that you do need to see the nurse, your teacher will contact the nurse. Either you will go to the clinic or the nurse will come to see you at your class. She may be wearing some extra protective gear because she will need to get close to you to see what is going on. She'll ask you a few questions and will take your temperature. If you end up having to go down to the clinic with the nurse will place an additional mask over your mask that you have on. You will walk with the nurse down to the clinic. Once you arrive in the clinic, the nurse will have you lay down or sit in an area that is separate from any other students. The nurse will be contacting your parents to discuss having you picked up from school. Now, parents, please be prepared to be called regarding what may seem like minor symptoms. Children with COVID-19 often do not exhibit the typical adult symptoms, and we must be cautious during this time. When we call, we will discuss your child's symptoms to determine possible causes and the best action. You or someone you designate will be expected to pick up your child within 30 minutes. If your child is sent home for symptoms of COVID-19, they must stay home until they are fever-free for 24 hours without fever-reducing medication and their symptoms have improved, and 10 days have passed since the symptoms first appeared. They must meet all three of these criteria to return to school. Your child may also return to school if you obtain a negative COVID-19 test. Please be sure that this test is either a PCR or antigen. They also will need to be fever-free for 24 hours without fever-reducing medication, and their symptoms must be improved. If you take them to their physician and the physician identifies an alternate diagnosis and a date specifying when it is safe to return to school, they may return to school with that note. Thank you for watching. Together, we can make a difference.